All right, everyone. Thank you for joining me. Hopefully you can see my screen. The tool that I chose to implement that's technology-based is high fidelity simulation, especially using this during our pediatric rotations in the undergraduate nursing community. So realistic simulations are becoming more and more popular in undergraduate nursing education. This is because it really does provide a safe learning environment to practice those pediatric skills. It's been difficult in the past for people to find locations specifically for pediatric rotations. So simulation helps to fill that gap where our students need that hands-on experience, but might not be able to get into a clinical site. Simulation does lack that real life component of dealing with actual patients, but it is, better than just reading from a book. So it is kind of that hybrid balance that we have between the real life and learning from our textbooks. So the objectives that we have when we're using a high tech simulator are that our students are going to perform age appropriate pediatric assessments. They're going to be able to recognize early signs of deterioration in their patient. They're going to communicate effectively with the parents and caregivers and the other team members that are there. They're going to demonstrate safe pediatric medication administration along with dosage calculation, and they're going to be able to apply therapeutic communication and use age appropriate discussions when dealing with these children. So the tool that I chose to highlight is high fidelity pediatric mannequin scenario. And I added in there kind of a hybrid scenario where we're making sure that we have an additional person in the room to play, as an actor, to act as the parent or family member in that situation, because that is something that's overlooked, I think, sometimes in simulations, is that when you're dealing with the pediatric population, there's a really great chance that you're going to have a family member present that's going to heighten the emotions. And that gives us a chance really to use the simulation to practice that communication involving not only the patient, if it's appropriate, but the family members as well. So again, why did we choose to use simulation tool in pediatrics? Because these sites are really limited. There's competition constantly for schools and classes to get into these rotations, and certain floors can only take a certain amount of students. So not everyone is getting that hands-on clinical experience in the pediatric world. And when they do get that experience, they may not see all of those high acuity situations that are kind of few and far routine. We're not seeing codes frequently or, life threatening things every time that our students are doing their clinical rotations. So this helps to simulate those experiences that they might not get, even if they do have access to a clinical site. And so this simulation allows us to expose our students to safe and structured scenarios that we can repeat and see if we can get different and better outcomes for our doll. So again, why did we choose simulation and where should we implement it? I think simulation is great because it matches program learning objectives for pediatric courses. You're able to practice those assessment skills, practice those technical skills, deal with different weight dosages, smaller dosages, again, applying that pharmacology math. I think that this should be implemented first in the beginning of a pediatric rotation, just because this kind of increases the comfortability of the students when dealing with peds patients. I think a lot of nursing students come in and they may not have a lot of interaction in their past dealing with children in general, or especially dealing with sick children. And a lot of times the pediatric rotation comes in the middle or towards the end of nursing programs. So students are kind of used to dealing with adults. So I think implementing this at the beginning of a pediatric rotation will kind of make them a little bit more comfortable when they do have that hands-on experience with a child. I think this is also important to implement in the pediatric ICU setting. This would be great, if hospitals and health organizations could utilize this tool as well to, run code scenarios and those high risk situations. But I think this is great for classes or students who are going to be placed in an ICU settings. just because these are going to be high risk situations. So that this will give our students and our nurses, if we're using this in the hospital, more confidence during these high emotional situations. And I also think that we should use pediatric mannequins just throughout the whole of our nursing education, just to kind of build those reminders about the differences between pediatric patients and adult patients, and also having a pediatric patient mannequin along with either, an actor or a student or a faculty member acting as a family member is a good way to reinforce that communication that we need to have with the family at all times and practice how to deal with those high emotional situations. So using these dolls and these mannequins and using these clinical situations really helps to support the development of clinical confidence, helps to build teamwork as you're going to be working with other people during this simulation, with somebody acting as a nurse, somebody acting as a family member, maybe somebody as the pharmacist, somebody as the provider. So you're going to be able to really improve communication there and delegate tasks to appropriate team members. It's also going to help us prioritize skills and making sure that everything that we're doing is really aligning with pediatric nursing competencies that are part of our curriculum. The learning domains that are associated with using pediatric simulation tools are cognitive. We're using our clinical reasoning, prioritization, and recognition of pediatric deterioration in these simulations. Also utilizing the psychomotor domain by assessing those pediatric vital signs, using dosage calculations, doing proper medication administration, things like airway management, and just prioritizing what intervention is needed for the child at that time. The last domain that we will discuss is the affective domain, and this is where we're going to be building confidence in our students, improving communication with family, identifying that cultural sensitivity that's involved in these scenarios, and building self-efficacy. Throughout looking into this tool, I did find several articles. We had some systemic reviews that showed that pediatric simulation-based education does improve knowledge, clinical judgment, and technical skills. Random control trials also confirm there's significant improvement in competency and clinical performance after the use of simulation-based education. And we have qualitative studies that show an increase in confidence and a decrease anxiety in pediatric care, which is important when we send these nurses out into the world. We want them to feel confident. We want them to, provide great care to our patients. Give me just a second while I open this YouTube link just to have a brief view of the mannequins that this school uses. They have pediatric mannequins, infant mannequins, adult mannequins, and OB mannequins, I believe. So let's take a quick look here.
My energy bill dropped from $150 to $50.
Here. All right, so that was just a quick example of what these really nice high fidelity mannequins look like in play in different institutions that are utilizing them now. So the nursing theory that I found that relates to the use of simulation is Kolb's experiential learning theory. Um, how it relates is through the concrete experience. Students are engaging in realistic pediatric scenarios during the use of these mannequins. It also utilizes the aspect of reflective observation. So after the scenario is finished, the students and faculty have a debrief, they reflect on their actions, they're able to discuss their emotions, their communication between team members and family members, and how the outcomes came. And it also utilizes the theory component of abstract conceptualization. This is where the learners are able to take what we've learned during lecture and from our textbooks and actually connect them in person to applying them to a pediatric patient using that evidence-based practice. So they get to have that hands-on experience, they get to reflect on it, and then make that connection from learning what happens in the books to seeing how it is applied to a real life patient. And how we're going to use Kolb's theory to really get kind of staff and faculty buy-in to use this technology tool. Starting with the concrete experience, we'll give faculty a hands-on encounter using that simulation tool by themselves. Maybe host a faculty demo where they will experience the scenarios and kind of rotate through the roles as the person who does the controls versus acting as the student who will be learning from it. And that's just going to kind of ease them into it and have a no pressure environment. So that they'll kind of build their familiarity, kind of reduce the anxiety associated with using a new tool in teaching. And then also utilizing Kolb's theory, we would use reflective observation after the staff has tried the simulation lab, kind of debrief with the faculty members afterwards and allow them to identify challenges and benefits of using this simulation tool. We'll also use the abstract conceptualization of the theory to highlight how using these mannequins aligns with course objectives, really emphasizes competency-based education, and prepares students for taking the NCLEX. We can also use this time to demonstrate how simulation can be used to replace clinical hours, especially if there is limited availability on finding clinical sites. The advantages of using this simulation are that we're going to increase our technical and communication skills during that created event. This is also a safe environment for managing pediatric emergencies since we're not using an actual person. We have that opportunity to make mistakes and learn from them and continue to grow and improve our knowledge as we make those mistakes and as we are able to identify them. This also helps to enhance cultural competencies in family-centered care as we're able to kind of just apply different cultural aspects to this mannequin and assign it to them and change our plans of care and our ways of communication based on what that mannequin is meant to represent at that time. This meets the students' needs to practice their clinical judgment through different learning styles, and this allows faculty to evaluate these competencies in real time. Ways that we would go about facilitating the use of these mannequins are making sure that our staff have hands-on training with the mannequin and the simulation tools and that they're comfortable with it. Make sure that they're efficient in running these pre-programmed scenarios, that they've done it several times before they use it with their class, that they're going to have the knowledge of just in general pediatric nursing. We're going to make sure that they're trained in debriefing so that they're able to optimize that time after using the tool so that they can go through all of those positives and negatives of the scenario in a safe environment. Also using psychological training to ensure that using this simulation is really a safe learning space for students and that they feel safe making mistakes, that they feel safe communicating, and that they're getting a positive experience out of utilizing this simulation tool. And then for evaluation strategies, as we're using this tool, we can utilize checklists, observation tools, objective structured clinical evaluation. We can use self-reflection after the scenario during that debriefing, and then using standardized competency validations, whatever is required by the nursing program itself or state board requirements. I do think the most important part of utilizing the simulation tool is really the debriefing that occurs afterwards, so that students can reflect on their decision making, that they can connect what they did physically with the mannequin to what they've learned in terms of interventions. And then it helps kind of prepare for emotional reactions and family communication, kind of talking through how they interacted with the family and what they might do different in the future. This time of debriefing also is a chance to identify those knowledge gaps to improve on future performances and improve when we actually send those students off into the real world clinical settings. So in general, I really feel that high fidelity simulation tools, especially in pediatrics, is a great way to strengthen clinical judgment, improve communication, and improve self-confidence. I do believe that this tool supports core competencies that are required for safe nursing practice. And looking through the articles, I believe that evidence supports the integration of simulation in pediatric nursing. Thank you guys so much for joining me.